Welcome to St. Mary's Joint Replacement Preoperative Education class. My name is Lisa. I'm the director of the unit. What we're going to cover today is how to prepare for surgery, what to expect after surgery, recognizing and preventing complications, and how to stay active after surgery. How we are going to do that is everything is in the book. We are going to cover front to back, but I am not going to read the book to you. What you need to do with that patient education guidebook is you need to bring it back with you whenever you come in for surgery. And you also need to bring it to your follow-up appointment with your surgeon and also for your outpatient physical therapy sessions. What we highly encourage everyone to do is to enlist a coach. You need to enlist that coach. It can be a friend, it can be a family member, it can be someone from church, anyone that you feel comfortable with that will help you after surgery. You need to pick that person, let them know that we encourage them to be here during surgery and after surgery to learn the exercises that you will do, and then to take you home after the hospital stay. The coach is important. It's someone that will help you for a few days at home also, someone that will give you support and know the exercises that you need to do. Also, at this time, I highly encourage you to start making your discharge plans. You need to do that before surgery. That way you can have everything prepared. You will need someone to stay with you for a few days after surgery, do meal prep, that will help with laundry, help to take you to your outpatient physical therapy sessions, and also someone that will take you to your surgeon appointments. That person's very important because you will not be able to drive for 2 to 3 weeks after surgery. Also, you need to start thinking about your options. We prefer that our patients go home after surgery. That is our number one choice for all of our patients. You recover much better in your own home setting. But if you have other options that you need, so home health is another one, that home health will only be for physical therapy. It will not be for home care such as bathing or anything like that, just for physical therapy sessions. And then after home health for 2 or 3 weeks, then we encourage you to go to the outpatient setting. This will help you get more active and out of the house more. We also have skilled nursing as an option. Skilled nursing is the last option that we have. That's only if you have someone that cannot take care of you at home and you live alone. That would need to be discussed with your surgeon, as long as the same as home health needs to be discussed with your surgeon prior to surgery. If you do decide to go to a skilled nursing, it is located in nursing homes in Enid and the surrounding areas, and you would have to stay 3 nights in the hospital before you're able to be discharged. We also need you to report any infections or cuts to your surgeon prior to surgery. This is important because you do not want to come in with an active infection. Also, you need to report any low-grade temperatures or any kind of wounds that are not healing, such as cuts that are not healing. You need to report that before you come in for surgery. Medication instructions. It's important to discuss with your pre-op nurse your medications. Make sure you have a current medication list. She will go over which medications you need to stop taking, when to stop taking them, and which ones you can take the morning of surgery. That includes heart medication, blood pressure medication, and blood thinners. The surgeon will go over your blood thinner options if you have to stop the current ones. Also with pain medication, most of our patients stop their arthritis medication before surgery. So most of the options are just Tylenol unless there's other plans or other options with your surgeon. You do not stop any medications without the permission from your physician. This includes diabetes medication that you will not take the morning of surgery. It's important that we check your blood sugar and that we monitor that and treat that as needed before surgery. Same thing with herbal medications. It's important that you report any of those, even over-the-counter medications that you may take. It's important that the physician and the pre-op nurse know everything that you take before surgery. Make sure that you have an updated list of medications whenever you come in for the pre-op nurse and also whenever you come in for surgery. We will have to reference that medication list numerous times just to make sure that we're updated and current on everything that you take. We will restart those medications after surgery. Typically the day of surgery, we restart everything depending on what your blood pressure is and what your blood sugar is. Eating right before surgery helps with healing. You need to increase your protein intake, increase your water intake. In your book, there is a list of items that you can eat that will increase your protein. You also need to eat 3 square meals a day and snack throughout the day, something that has increased protein in it. It's good peanut butter, eggs, those are some items that have lots of protein in them. They help with your healing. So increase those before surgery will help when you come in. Also, you need to follow that after surgery for several months. What to bring to the hospital. If you are having knee surgery, you need to bring shorts, something that's easy on, easy off. If you are having hip surgery, you can wear pants, but they also need to have an elastic waistband, something that's easy on, easy off. Short sleeve shirts are preferred. We keep our common area a little bit chilly, keeps our patients awake, helps with nausea. If you are cold-natured, you can bring a sweatshirt or sweater, something that we're able to get to your arm easily for blood pressure checks and check your IV. You also need to bring a good pair of shoes. Tennis shoes are preferred, something with the back that is easy for you to get on and off. We will help you, assist you with tying those things, putting those on, but we want something that's fairly easy to put on. Bring a couple of sets of everything. No Crocs, no flip-flops, and no boots are preferred. Those things are very difficult to walk in. Also, you need to bring your toiletries, lotions if you wear makeup, hair products if you need them, soap and shampoo if you want to take a shower the next morning, you're able to do that. So you can bring those things if you need them. Toothbrush, toothpaste, things like that, bring those with you to the hospital. Leave valuables and large amounts of cash at home. You will need your driver's license for whenever you go to pick up your narcotic from the pharmacy, so make sure you have that. Also, you need your list of medications as discussed earlier. And if you wear a CPAP for sleep apnea, make sure you bring that. Also, a rolling walker is very important. It's a standard rolling walker with 5-inch wheels. Every one of our patients will need those. You do not need the walker that has 4 wheels and a seat, so do not bring that one. It's just a standard rolling walker that you can pick up from any medical supply store in the area. Also, if you're having total hip surgery, there is a list of equipment that you will need. These are must-haves whenever you come in. They help you with putting your clothes on, putting your shoes on. That way you do not break your hip precautions. The list of items are in your book, but I'm going to kind of go over them. It's called a hip kit. The hip kit has a sock aid, a long-handled reacher, a shoe horn, and a sponge. Those items will help you so you do not break the 90-degree hip precaution that you will be required after hip surgery. They come as a kit. So if you pick those items up, bring them in, and our occupational therapist will show you how to use those items. All of those items that I told you to bring, the clothes, the toiletry, the walker, and the adaptive equipment, you need to bring those in whenever you come in for surgery. It's important that you have those the day of surgery because we will use those the day of surgery. We get our patients up fairly early, so you will need them fairly early in the day. Pre-op exercises. That's also important. We encourage all of our patients to do those pre-op exercises twice a day with 20 reps each. We highly stress the arm exercises. You will be using a walker. Your arms will be part of your ambulation, so you need to make sure that you have strength in your arms to use the walker. You will not be using your surgery leg as much as you did before. You'll have to use those arms, so you'll need to make sure those muscles are strengthened enough to come in. Those list of exercises are typically given from the office, and also it's in your book. The day of surgery. Call before your arrival. If you are a patient of Dr. Fikes, you will call the hospital. The number is in the back of your book. You will call the pre-op nurse. You will just verify that your time is correct. If you are a patient of Teskey, Keller, or Hulse, then you will call their office and verify the time. Do not eat or drink anything after midnight. The only things that you will take is the list of medications that the pre-op nurse verified were okay to take before surgery. Also, the day before surgery, you are going to bathe with that special soap they gave you or the wipes that they provided, and you will also use those the next morning. Before you come to the hospital on the day of surgery, you need to use the special soap that they provided or the wipes that were provided by the pre-op nurse. When you report to the hospital, you will go up to the second floor. On that unit is the surgery unit. They will take you to your room that you will be in before surgery. You will have the anesthesiologist and the surgeon that will come in and talk with you before surgery. They will start your IV and get your consent signed in that area also. Whenever you go back as the patient to surgery, your family needs to take those belongings that you brought in with you, the equipment that you brought in and the clothes that you brought in. They will take those things to the third floor, which is the Joint Replacement Institute. Then your family is encouraged to go back down to the surgery waiting room. That is where the surgeon will look for the family to talk with them after surgery. After the physician talks with them, then they're able to go up to the unit on 3 West, or they're able to get something to eat or drink and walk around. As the patient, you will be in surgery for about 45 minutes to an hour, and then you'll be in recovery for another 45 minutes to an hour. Each one of our surgeons do something a little bit different with their anesthesia, and each patient is different. So they will discuss those options with you before surgery. That way you can go over your history, your medical history, or what will be used, and that way you're prepared for when you come in. Pain control will start in recovery. Every patient's different based on the anesthesia type that you have during surgery. Once you get to our unit on 3 West from recovery, then we will encourage you to get something to eat or drink as soon as possible. That way we can start oral pain medication. We also highly encourage the use of the incentive spirometer immediately following surgery. It's a breathing tool that will help blow off the anesthesia and help you to recover quicker. Also, it prevents complications such as pneumonia. Also, the day of surgery, you will get up and ambulate with nursing staff. If your surgery is fairly early, 7:30 or 9:30 surgery, you will see physical therapy and occupational therapy. But regardless of seeing them, you will also walk with the nursing staff. You will walk numerous times, even the day of surgery. We do not use Foley catheters, so you will be ambulating to the restroom frequently. You will also be dressed, so that's why it's important to bring those clothes when you come in. You'll get dressed and to ambulate in the hallway with others. The day of surgery, we do not have a set schedule for all of our patients. The following day after surgery is when we have our set schedule. That's when we highly encourage the coach to be there for the physical therapy and the occupational therapy session. Our patients get up typically about 5:30 or 6 in the morning. They get dressed. You can shower if you like. You will get dressed and you'll ambulate at that time. Also, your meals will be at 7:30 and 11:30. Physical therapy sessions are at 8:30 and 1 p.m. You will do lots of walking in between those sessions. It's encouraged that you get up and move frequently just to help with the pain control and help with recovery. Also, the day after surgery, the surgeon will come in. Typically, they come in about 7 or 7:30 in the morning. So it's highly encouraged that the coach be there if they would like to talk with them. That's when they will discuss discharge. Most of our patients will go home the day after surgery. And if you are discharged the day after surgery, it will be in the afternoon, about 2 or 3 o'clock, after you do your afternoon physical therapy session. On the unit, we have a board that measures your ambulation distance. This helps you visualize your goal. It may help you want to walk more or be more ambulatory on the unit. Group therapy is an important part of your recovery. We use that as a way to support each other. You will do that with both group therapy sessions on the day after surgery. We highly encourage coach participation with that. They are encouraged to be there so they know what physical therapy that you need to do at discharge. On discharge day, the majority of our patients are discharged the following day, about 2 or 3 o'clock in the afternoon. To be able to be discharged, though, there's several things that we would like to cover. We want to make sure that you're able to do stairs safely. We also want to make sure that your pain is controlled. Before you are discharged, we will set up your follow-up appointment with your surgeon, which will be 10 to 14 days following your surgery. At that appointment, they will remove your staples and then do another x-ray. That way you can visualize what your post-op knee or hip looks like. Also, we will make your outpatient physical therapy appointments. We like to make your first appointments. The ones after that you're able to make on your own depending on your transportation. But we will make the first one and it will be started the week of surgery unless there's a major holiday or something of that nature. A pain medication script will be sent to your pharmacy of choice at discharge by the surgeon. You will also be sent with a stool softener and a blood thinner of some sort depending on your history. Recognizing and preventing complications. Potential complications after a total hip or total knee surgery are blood clots, pulmonary embolism, infection, pneumonia, and hip dislocation after hip surgery. Blood clots are swelling in the calf, thigh, or ankle that do not go down with elevation. Also, pain or tenderness in the calf, and it can be your surgical leg or your non-surgical leg. If you do not know you had a blood clot and it breaks loose and travels, what that is a pulmonary embolism. That's sudden chest pain, difficulty breathing, shortness of breath, sweating. You need to call 911. That is a medical emergency. Ways to prevent blood clots or pulmonary embolism: ankle pumps, early ambulation, SCD machines that we'll use while you're here, and blood thinners. All of our patients will be on some sort of blood thinner at discharge. We will start those immediately after surgery and you will be going home with them for typically 2 to 4 weeks after surgery. Infection, a red wound, increasing pain, increasing swelling, and a temperature of 101.5. A low-grade temperature typically is an indication of pneumonia, not an infection. What you need to do to prevent infection is you need to keep the wound clean and dry. At this time, we use a dressing called Aquacel dressing or Dermabond dressing. You will need to keep those in place until your follow-up appointment unless instructed otherwise during your hospital stay. Also, immunosuppressive drugs. You need to make sure that your surgeon's aware of every medication, such as immunosuppressant drug that you're taking, which increases your risk of infection. You'll also need to notify your dentist or other surgeon if you're having another procedure after joint replacement. That way you can do a prophylactic antibiotic before those procedures. Pneumonia, cough, fever, shortness of breath. You need to report any of those signs to your surgeon. Ways to prevent that is deep breathing, the use of that incentive spirometer that was spoke of earlier, and you need to get up and ambulate frequently. Dislocation of the hip following hip surgery. You need to follow your hip precautions that are instructed to you by your physical therapist and your occupational therapist. You also will have increased sudden pain in that hip. You will have inability to walk, and that operative leg will be shorter than the other. Pain and discomfort. You will be prescribed an oral pain medication. You're encouraged to take that every 4 to 6 hours at home as needed for pain. Also, we highly encourage that you take that before your physical therapy session. Most of our patients are able to get off those pain medication about 2 weeks to 3 weeks after surgery. You're highly encouraged to get off of that as early as possible. Also, that is one way you are not able to drive while taking narcotics. And a lot of our patients are able to alternate with pain medication and Motrin or Tylenol. That way they can take less of the narcotic compared to other medication. Also, cold therapy. If you're having knee surgery, you will be sent home with an ice machine. We will show you how to use that before you're discharged. We highly encourage that you use that after physical therapy, after you get up in the morning, and as frequently as you need to help with pain and swelling. If you're having hip surgery, you can use an ice pack as needed for pain relief. Also, you need to reposition and walk frequently. That helps with pain control and helps prevent those complications that were discussed. Fall prevention is highly stressed after total joint replacement. You need to make sure that your house is prepared after surgery in a way that you need to pull up throw rugs, electrical cords. Just make sure that you have a path to get through with your walker. Also, if walking outside, you need to choose areas that are smooth, someplace that you're not going to have a trip hazard. When you will hear from us will be 1 week post-surgery. You will hear from a nurse from our unit. She will call just to verify and to see how everything's going at home. If you have questions or concerns, you can speak with her about that also. And 6 to 8 weeks after your surgery, we will send out an invitation to a reunion lunch. We encourage all of our patients to come back at that time. You're able to visit with the nursing staff, you're able to visit with someone from surgery, and usually a surgeon tries to get to that reunion lunch. What we do there is we focus on your recovery. We talk about your goals and we talk about your surgery and home recovery. If you have questions, our number is in the back of your book. My number is also in there. Like I said earlier, my name is Lisa. I'm the director, and you can also call up there and speak with any of the nursing staff, and they should be able to answer your questions. If not, someone will get back to you as soon as possible. Thank you for choosing St. Mary's Regional Medical Center.